Well, it is 8:32, and I know we've got a busy day, and so I want to be able to allow us time to do the business of the morning, and then be able to transition to our business of the later morning. So, with that said, I will call the meeting of Public Health and Community Services on September 29th to order at 8:32. Roll call, please.
Bates.
Here.
Meshes.
Here.
Schofield. Here. Gendrick. Schwartz.
Here.
Jensen.
Here.
Von Bergen. Parrish.
Here. Alrighty, thank you all for being here this morning. Agenda item number 2, minutes for approval. Motion, can I seek a motion for Public Health and Community Services public meeting minutes September 1st, 2022?
So moved.
I second. Thank you. Any discussions, questions, corrections? All right. Hearing and seeing none, all those in favor of approving the minutes, can I do that, or should we do roll call?
No, you can do
Okay, great. All those in favor?
Aye.
Aye. Anybody opposed? All righty, perfect. Moving on. All right, any member, well, let's see, public comment first. I see no one listed at public comment. Any public comment? No. Public comment? No.
Okay.
Staff. All right, so, member comments.
I just want everyone to know the mental health board met, and it was for grant reviews. And it was a pretty long meeting, and we're gonna be meeting again October 5th and October 12th. We've narrowed it down to, I think, 5 or 6 agencies coming in and presenting. And I put my mental health board report in all of your boxes, but of course, there's more money requested than what we have available. So it's been a real challenge, and discussion about gaps of mental health services, especially adolescent substance abuse, and you're shaking your head, yeah.
I'm just,
Yeah, and
agreeing.
also residential substance abuse. And we're really looking at that seriously in the future, but there's just only so much money available. So I have the base numbers for you in my report about what's requested and what we have available. And it was a very substantive meeting
great.
and very well attended by the agency, so
Oh, excellent.
that's
Okay.
it.
All right, thank you, Dr. Jensen. Any other member comments? Okay. I was thinking I had some, and now I've lost them in my discombobulated morning. So, they must not have been that important. Okay, so new business. There's nothing listed there, so let's move on to the routine consent agenda. Any members wishing to pull any of the items 6.1 through 6.6 off the agenda?
6.6.
Okay. Oh, yes, thank you. Yes, I was gonna do that, so, thank you. Any others, 6.1 through 5? Any discussions about those? Alrighty, so can I get a motion to approve the routine consent agenda for items 6.1, 6.2, 6.3, and 6.4, and 6.5?
So moved.
Second.
Excellent, thank you very much. Alrighty, so those items are approved. So then we'll go back to item 6.6, the ordinance. Oh, I'm
You
sorry.
need to vote on it. Sorry.
I'm so excited to get to 10 o'clock. I just want to make sure everybody's on time to 10 o'clock, not 6 o'clock, 10 o'clock. Okay, it's been a morning already, sorry. Okay, so let's go back and vote on items 6.1 through 6.5. Please.
Jensen.
Yes.
Bates.
Yes.
Schwartz.
Yes.
Meshes.
Yes.
Schofield.
Yes.
Parrish.
Yes. Thank you for keeping me honest. All right. Now we'll go on to 6.6, the ordinance amending articles 1 through 11 of the public health ordinance.
1 through 6.
1 through 6? Oh, that's, see, I'm
It's
just
okay.
gonna, thank you everyone for helping me get through this morning.
Mornings are rough. I have a hard time in mornings, so.
Well, this one was interesting, so thank you for being here, everyone from public health.
Thank you. And we were gonna do a presentation, but I guess the overhead is not working.
Okay.
So Patty is gonna be doing the bulk of the presentation where, looking at we've made changes throughout Articles 1 through 6. So she's gonna cover the highlights and then we'll just be ready for questions. And then just so you know, my apologies, the resolution is correct, but the background information is an old document. We will get it updated. It's Article 7, the fees, which we did earlier in the year. I will get that updated before it moves forward, so my apologies for missing that.
Okay, thank you. All right, thanks, Patty, for being here.
Okay,
Mary
so
Ellen. Thank you.
I just wanted to kind of go through the process that we've done here, just with the revisions. We tried to be very, very transparent. So we released several press releases. We've posted all of these proposals onto our website. We've reached out to every one of our regulated community groups, professional organizations, state agencies, municipalities, et cetera. Anyone we thought may have an interest in what would be in the public health ordinance, which is everyone. We tried to reach out to them. So we did have the 2 public meetings. We had one in Crystal Lake and one in Woodstock. We only had 2 attendees, 1 at each one, 2 county board members. We appreciated them. We also met with our food establishment owners and operators, all of our water well contractors, our private sewage disposal contractors. So really in total, to our 4 meetings that we had a total of about 30 people. We've received just under 90 comments on it, so we did, in every notification we sent, we tried to solicit comments from anyone who may be interested. The majority of comments were received on the private sewage disposal ordinance. That's very typical. Most of them also were provided by one designing engineer. So in that process, I've responded individually to everyone who provided a comment, so I think you would have received that summary. So we created a summary, it's on our website also, of every comment received by article, what the comment was, and what the department response was. So I reached out to everyone who provided one, and I think that, any concerns that they had have been addressed. We did incorporate 23 changes into the ordinances based on those comments, so, things that we could work with that would make it easier for people, we tried to incorporate those in. And right now, what we have pending would be our formal review from the state's attorney's office, so we're still waiting for that. And then we're also resolving some concerns with the Illinois Department of Public Health regarding our water well ordinance. So I've gone through that process, we're in discussion, actually in disagreement, but we are in discussion to resolve those. So I'm required to have IDPH approval for my water well ordinance, and so if there's anything substantive or it cannot be resolved, then I would obviously bring that back to the board before going through the next steps. So if you are willing to move these forward today, I have offered to do a presentation at Planning, Environment, and Development Committee on October 4th. It's not really one of the formal processes, but with water wells and septic systems, I think it's a good idea since it impacts, development, construction, et cetera. And then our hope is to be on 30-day review on October 13th, and hopeful that the county board then would formally approve the ordinances on November 15th for a December 1 implementation date. So that's the process we have gone through, and I do have actually a slide on each one. If you'd like me to go through each of the articles, we can do that. Or if you've read the summary document and you have questions for me, whatever you would like to see.
Anybody have questions? I appreciated, Patty shared at, today's Thursday, so Monday at Board of Health, she shared and we were able to see the slides. And I appreciated hearing about all the efforts for public comment and the outreach and the follow-up and follow-through. So thank you very much for your due diligence in that. And it was exciting that you had engagement, so certainly
Yes.
you'd always want more, but
Right.
that's great.
But the process has actually been quite smooth in that regard. We've had a lot of actually nice discussions with the groups that, work with us routinely, so I think it's been a positive experience overall so far.
Was there anything that glaringly you spoke about at the Board of Health surrounding these? I'm sorry.
I'm trying to remember, no, good question. Oh, did you have a question?
Well, we'll answer that question first.
Well, I'm
Yeah.
trying to think, Patty, anything that stuck out to you at the Board of Health meeting? Or any
No.
highlights that you want to share with the group?
Yes, we did have one comment through the state's attorney's office regarding our food permits and just some clarifications regarding food permits and suspensions and then reinstatement of those permits. So we made some adjustments in our food ordinance to make it clear, to make sure that everyone would be aware, tying it all together for the appeal process if there's a disagreement, and then reducing the amount of time where a permit or reinspection would be done when a person requests reinstatement. So we've tried to kind of tighten that up, smooth out the process, so it's clear for everybody.
Is this a yearly process?
Of reviewing the ordinances?
Yeah.
Well, we do review them internally every year, but we don't every year have really a significant change.
Okay.
So I would just tell you, the internal process is as soon as they're approved and then we realize we made an error or something else, we write it on the cover and we kind of bring it around and roll it into the next one. And so it's really Melissa's decision, when she reviews it with division directors, if it warrants bringing it forward for an ordinance change.
And I remember, is it the water and sewer where you
Yes.
had a professional contractor or some from the community that suggested a lot of changes?
Absolutely.
And
Yes.
can you speak to that a little bit? It was
Sure.
very
So-
interesting.
So we did meet with our contractors for water wells, et cetera. And so there were several things in there that they encounter all the time. For instance, they wanted us to tighten up a little bit about who's responsible for which types of things, because water well drillers apply for a lot of permits, but they don't own the property. So we did that for them. They also wanted us to tighten up some things when residents share water wells so that we don't have any issues with people cutting off water or disinfection, things like that, so we were able to do that. One of our biggest discussion points was how to, what method to use to make it easier to locate these actually plastic seepage system devices in the fields now. When I was in the field many years ago, it was all gravel type systems. Now over 90% of them are plastic chambers and they function perfectly well. But as an inspector, can't go out and probe those without damaging them. So we're trying to figure out a way to make it easy when people want to do future on-site developments or improvements, that we can locate those easily, and not have to have them hire contractors and things like that. So it was a big discussion, but I think we've worked our way through that.
Any other comments or questions? Anything that you'd like to share?
Yeah, I think there's just two things I want to make sure that you're aware of in ours. One is that we have switched out, normally we charge, we ticket someone, $200 when they don't register, and only $50 when they're not vaccinated, when their animal's not vaccinated. And we switched that. So I think it's far more important to make sure the animals are vaccinated, and yes, of course, we want them to register their animals. So we switched the $200 to the vaccination, because that's really the key component of having people comply, is having their animals vaccinated. And then the other is that we are not going to be enforcing barking nuisances in the towns. We will be doing an unincorporated McHenry County, but the cities and law enforcement are really much more able to enforce any barking issues in their community, because the barking a lot of times is happening at nighttime, and we're not going to be going out on calls after hours for barking. So it really is much more prudent for them to handle those. And, they all received that. They received it first from me in May, and then again when we sent out the ordinances, and we really haven't had any. Oh, and I spoke to all the chiefs about it last week, and we haven't had any pushback on that, so.
Well, that makes sense.
It really does.
Yeah, it does. I mean, municipalities vary in the enforcement of barking. Some of them have noise ordinances and whatnot, so it makes sense. I mean, I think you're doing the right thing.
Yeah, we just don't have the ability to enforce them after
Yeah.
hours, and the municipalities are much more able to do that.
Mhm.
Right. Well, thank you very much. Any other comments or questions? All right, then we need a vote.
We need a motion.
As well.
I'll make a
That's what I
motion
thought.
to,
Thank you.
for ordinance amending articles 1 through 6 of the public health ordinance.
I
Thank you.
second.
Thank you. All right. Any other last minute discussion? Okay, now we need a vote.
Now you can do it, Lori.
Huh?
Bates,
I'm gonna figure
Yes.
this out before.
Von Bergen,
Yes.
Meshes,
Yes.
Jensen,
Yes.
Schofield,
Yes.
Schwartz,
No.
Gendrick,
Yes.
Parrish.
Yes. Alrighty. We have nothing listed under, thank you, ladies.
Thanks for your hard work.
Nothing listed under old business or presentations. We do have a report, winter emergency shelter update. Mr. Hartman and
Hans to
Hans,
assist.
Mr. Monk.
Hi. Good
Awesome.
morning.
Thank you. Good morning. Thank you both for being here.
As you recall, last year, we ran into an issue where we had after-hours emergency weather needs for our homeless population and the challenge of how do we address that. There was an apparent gap in the services. So in the scramble, the county worked with law enforcement officials and developed a relationship with a Super 8 hotel in here in Woodstock where local law enforcement can, if they see somebody that's in need, they can bring them to Super 8. Super 8 would provide the room. We had funding through CDBG funds, which Hans could speak to specifically, which funding to cover that cost, and that resolved the problem. And the intent that was an emergency solution. We got through it. We probably had about 10 or 12 or so clients through that approach. But we wanted something a little bit better, a little bit more structured, a little bit more strategic moving into this year. So we endeavored to bring that to the committee and to the county, and Hans and his team put out an RFP to try to find a provider for that service. So with that, Hans, I'm going to hand it to you, and you can let it know where we're at.
Yep, so we did issue that RFP. We did get some inquiries regarding the RFP, but ultimately nobody completed a request for the funds. We had roughly between $18,000 to $20,000 available for that, primarily of which would be motel voucher costs, just to account for the fact that we could have a severe winter and we may need to use that funding longer. Given what we had last year, I think we had a milder winter last year, I would contend. We didn't have an extreme amount of use for it, but it was one of those situations where we just didn't get a response. So we've had some more conversations in the past week since we didn't get any feedback. And feel as though the direction to go at this point would be to proceed as we did last year. It's sort of, it's an intervention that the law enforcement can use if they come across a homeless individual, and there's a potential for lethality of that individual. So we are just seeking direction at this point, I would say, unless you have more to add to that.
Actually, it's more of a report. What I'll add is, there's one provider that Hans and his team are working with that expressed interest in providing the service, not through the RFP process. We're having those discussions, but as it stands, we're not sure if that's going to pan out before the winter. What we want to provide to the committee, though, is our solution from last year will transfer to this year. We will put that program in place. It worked. And when we come into the winter months, we have a solution. Our law enforcement partners are well aware of that, and we can just recreate what we did last year for this year with the funding that we have. So I think we have that solution solved. Ideally, we'd like to have a provider to be on the front end of that, but you know, I'm not going to say we're optimistic that that's going to happen, but I want to report to the committee that we're not going to walk into this winter without a plan. We have a plan. We're looking for a better plan, but we have a plan, and that's to continue what we did last year. So it's a report. Any questions?
So I assume, is it?
Sure. Go ahead.
I assume that you have money available to help with this provider to provide that service, to provide that service. How much money do you have?
Between $18,000 and $20,000.
Did you mention that earlier and I didn't hear it?
Yes.
I'm sorry.
No, that's okay. Well, yeah, we do have that available. So it's something that this activity has actually been set up since we received the COVID funds back in 2020. And it's just kind of lingering along as an intervention to prevent coronavirus from spreading. So that's something that we would like to continue as well.
So Do you think that's enough money based on past, service provider history?
Yes, I do, provided that we don't have an extreme winter. Last year, I would say was probably a little milder. I would say if we had more of a moderate winter, we would still be fine. If we had something really extreme with a high population, we might probably run out of funds probably by the end of like March. It's just a good way to predict that. Typically, our cooler weather like that's gonna be the December to March periods, and then after that, we start to let up a little bit.
And just to be clear, when we say the gap in service, really, this is an emergency after-hours gap. If somebody is, say it's 4 o'clock in the afternoon and we know it's gonna get cold, the Pioneer Center does have an intake process in which they can take somebody in and process them, and the Pioneer Center will handle the service. The challenge is, after about 8 o'clock or so at night, there's really nobody there to conduct the intake, and that's the service gap that we discovered. So we're only talking in the late after hours in which law enforcement would encounter somebody that is in need of service.
And so the RFP was for someone to connect with law enforcement at those hours to get someone to someplace, or the RFP was for vouchers?
For vouchers and for some case management assistance and that connection in the morning between the client and Pioneer Center.
And
Which
how
could
do
have been
those
Pioneer Center.
referrals come from? Do those, usually those referrals, getting back to what Lori's saying, those referrals, do they usually come from law enforcement to this entity after the hours? I mean, where do the referrals come from?
They do. They come from the law enforcement in the morning hours. The immediate response is that the law enforcement places the individual into the motel with their badge ID.
Right.
And in the morning, the connection is made between the client and Pioneer.
So hypothetically, we could be using the social workers that are working within the different municipalities when they're working with law enforcement and they're out in the field after those hours, right? So you have also a system in place now, right? No?
There would be a system. I think the issue tended to be that there's not like the case management type transportation and whatnot available. That's where the missing link is. And so in many cases, if the weather got a little bit better in the morning, they would probably just move on or something like that. Whereas they're not making that connection to the shelter system that would be needed in order to ensure that they don't surface in a few days later.
I'm just working from a systems perspective and providing some kind of substantive referral opportunities once the individual gets into this after-hour place, so that they don't, I hate to use the word get lost, but they're a part of that process, so that maybe they can work towards a better place, well-being, you know?
And that was our hope with the RFP, that we would have more of a connection there, that would be what they would use a portion of the funding for. Again, the bulk of it being the high costs of hotels and vouchering, so that would take the bulk of whatever the funding we had available.
Well, once we get them through the night, and they go into the morning, then they can go through the intake process through Pioneer Center. So that's where I think that handoff is, but it was just that immediate need, say it's midnight and our law enforcement rolls up on the street,
Right.
it's 0 degrees, they have a place to take somebody and drop them off, provides for the welfare of that individual. We solve that problem in that immediate. And then in the morning, then we can work through the systems that we already have in place to transition them off, whether or not they go to a shelter or go to somewhere else.
Questions or comments? So you were seeking direction from us or
I think this
what
is
Well,
were you
the
needing?
first section, yeah.
Yeah, I think at this point, we just wanted to report to the committee where we stand, what we're looking forward to, and if there's any changes or any further developments with the social service provider, we'll be happy to come back and report on an alternate approach to this. But I said, as we stand today, we have that plan moving forward, and that's to continue to do what we did last year. It worked. It worked well. But it's, you know, it'd be easier if we had just somebody to really coordinate and pull all that together. And that's what we're looking
Is
for.
the COC involved, Hans, or
Um,
how might the COC be involved?
We actually were active in discussions with the COC to
Yeah.
encourage applicants to come forward. We did reach out to some institutions of faith as well, and we were hoping that maybe one of them would want to coordinate that. Commonly, when we're using what we would consider a subrecipient, their responsibility becomes incurring those costs and having to get reimbursed. And I think that's often a barrier for our organizations, and so it's easier for us to do that than it is for them.
Sure. Well, I want to acknowledge that it's September 29th, so thank you very much for talking about this in September and not February when it's predictions of below zero temperatures. So thank you very much for being proactive and getting this on the books now.
Thank you.
All right,
Thank you.
thank you. Okay, any future topics, suggestions and ideas from the group? You're saving up all of your comments.
Right, well, I'm
for
just
the 10
talking about-
o'clock- The 10 o'clock meeting, we're quiet this morning. Yes, Dr. Jensen, did you,
You wanna go?
Teresa?
Well, I was just thinking, like, I'm thinking, what are things that we should gonna be concerned about? And I was thinking, you know, somebody recently said, like, COVID's over. I'm like, oh, is it really over? What kind of public health issues do you think we're looking at in the future? So, like, you know, there was, in the last year, we talked about COVID and monkeypox and the flu's coming back in, like, other things we need to be worried about and planning for. So, a future topic, what are the things we should be looking out for?
Okay.
Oh, can I make a quick plug for it?
Sure.
So tomorrow, we have plugged it, is our community health improvement plan presentation at
Yes.
Henry County College. So
Yes.
it'd be great for everybody
Thank you.
to come to that. It starts at,
9, is it 9?
yeah, I think it's 9 o'clock. It's
11:30?
right on the scroll bar on the
Okay.
MCC?
website. No, I'm thinking the
Oh.
county website right now. It's right there. I can send out more information as a reminder, but that's something that we're gonna review the priorities.
Okay.
And it would be great if everybody can be there. We are going to record it and then we'll get that posted on our website after that.
And that's
As well as
MCC.
the plan will be posted, additional infographics and things like that.
And is that the presentation that we saw at Board of Health?
I think it's gonna be expanded.
Yeah?
Yes.
Yeah, great. Well, the one at Board of Health was,
And then we will bring that
Really
same
good.
presentation to the COW in October.
Oh, okay.
So if you miss it, you'll get a recap. It just will be a shorter presentation
and that's MCC, right?
Correct.
Not
That's at
11:30.
MCC. in the auditorium.
I have a suggestion.
Yes.
I don't know how many of you read about the Alden nursing home lawsuit that is being, because they were under, providing services to people that reside and McHenry Alden is part of that lawsuit, by AARP and, ACLU. And, if there could be some discussion from from someone from the Ombudsman program at Senior Services Associates of McHenry County surrounding, long-term care and advocacy for people that reside in nursing homes. It is unprecedented, I hope I said that word correctly, that, a lawsuit of this nature has moved forward and it's through, it is against the Alden corporation, and one of the nursing homes reside in McHenry. But they purposefully, the allegation is, they staff the nursing homes to maximize profits at the expense of the individuals that reside there. And it's very sad, but I think Tom Anarella has spoken to Valley High about some nursing homes will be going out of business. And there's gonna be an increased demand for those kinds of services, and what is it we want and the quality that we provide for those services for our older adults. But I've been tracking that. And you know, AARP is a pretty mainstream organization, is what I'm gonna say.
And so what's the topic that you'd like us to discuss
I would
in the
like
future?
to have someone give us an update about the ombudsman program
Oh.
and what does that really do and what kind of advocacy is occurring for people who reside in assisted living and long-term care.
Thank you.
That's a synopsis.
Okay, thank you very much. Any other?
Yeah, can I
Yes.
just go off of what Teresa was saying? There was an article yesterday about, and it kind of goes to Jeff, his request prior, update on different things outside of COVID. And it was on the 3 and under population and how they're now being exposed to
Respiratory.
to different viruses that they haven't been exposed to over the last 3 years because basically they've been locked in their house or wearing a face mask. So I'd be curious, we used to do that children's wellness fair and everything, and we don't do that anymore, correct? Like, I don't think it's-
So that might have been before my time, so was that something that public health did?
Well, I think it was in combination. I mean, I was part of the League of Women Voters at the time, and I know the League was really instrumental in doing it, and I think they partnered with the health department, and it was right before school would start and stuff like that. And I think it stopped, years ago. But just what is our plan then? I mean, there's a population now that, it's not COVID. It's RSV. I mean, my, kids would get it when they were 2 weeks old, and now they're getting it at 3 and 4, so what effect is that gonna have, and how, we need to look beyond COVID and and I don't wanna say how do we expose kids to these germs, but they used to say daycare kids were had the best immune systems, and now these kids have these very fragile immune systems that we've created for them. So, what are we gonna do with that, or, how do we let people be aware of that? And it's not necessarily bad to have your kid out playing in the dirt. So, just how do we get back to that, I guess, because we're paying the price now, and the kids are gonna pay the price in the long run.
Yeah, thanks, we'll put that on the list.
I
Yeah,
have one.
I heard that the other day. Yes, Jeff.
Diabetes is at
Yes.
epidemic proportions, and there's so much not artificial, but like corn syrup and things like that in all of our foods. It was put there to make it addictive to people, and doctors nowadays, you go in for a physical, and it's like, oh, your A1C is like 6.8, but it's supposed to be in the below 5, or below 5.8 or 9, and now even the doctors kind of just like blow it off, because it's sort of like everybody's in that zone now, so it's sort of like, but it's not healthy, and I am a type 2 diabetic, and I have a monitor on my arm that and incidentally, this monitor was something that I had to argue with my doctor, and I actually changed doctors because of it, because he wouldn't prescribe it. I couldn't go to the pharmacy to buy this monitor where I could monitor my glucose levels. I learned so much about blood sugar from having this monitor, from the time of day that I take my medication. A doctor says, oh, just take it with your meal, or take it 3 times a day, but the timing had a huge effect. So I would be bouncing out of the limit and down below the limit and all over the place, until I figured out by having this monitor, it allowed me to do that. So, I'm passionate about this because, I didn't know in my younger years what eating all this garbage actually would do to, basically wear out my pancreas, So, there should be some public awareness somehow, where we could somehow educate people, I guess, because And even the doctors not wanting to prescribe this device, oh, we only give that to people that shoot insulin, and your insurance may not pay for it. I don't care, I'll buy it, and,
Yeah.
you know?
Well, spoiler alert, that's one of the top 3 that they're gonna talk about tomorrow,
Oh,
that
right.
they found in the Healthy Community
Right, so
Study,
diabetes was one of, is one of the priorities, and so what
Yeah.
will happen, again, so totally encourage you to come tomorrow if you can't. There will be other opportunities for people to get involved, we will be creating these groups and specific strategies. We also offer diabetes prevention programs, so we already have some things that are very well received and based on evidence-based programming, but yeah, so thanks for the plug that, yeah, not to be a spoiler alert, but yes, they
I
will
would
be talking
love to
about
come,
this.
but I will be out of town, but,
Okay. But the
if
plan
in
will
the
be posted,
future,
yeah,
there,
Yes.
you know,
an opportunity for you to
there's
get
an
involved.
opportunity even to speak about it, I'd be happy to speak about that.
Wonderful.
I have, I guess, a question related to that, because I have a son who is type 1 diabetic. So, and there's a really big difference between the two, even though, you know, they're both diabetes. Are you going to be distinguishing between the two? Because I would often get press releases about, you know, different forums that the health department was putting on about diabetes, but it's always been about type 2, and there's really no distinguishing factor in that, and I guess I would
Yeah,
like to
I think for our purposes, it is primarily about type 2 because of diet, exercise, lifestyle related.
Well, I have put that on our list. I've got 4 items. I heard public health beyond COVID issues. I heard the ombudsman program and learning more about that. The children's issues, 3 years and under, and those concerns, and then diabetes. So certainly sounds like, you know, we can put public health on the next several public health and community services agenda like we have been doing. We didn't do that today because we wanted to be sure to be able to get us all to our 10 o'clock budget meeting. So any other topics, any other future topic ideas? All right, then no need for executive session, so can I get a motion to adjourn?
Motion moved.
All right,
So
Ms.
moved.
Meshes.
I'll second.
All right, Mr. Schwartz. And all those in favor?
Aye.
All right, anybody opposed? All right, thank you.